You're back with us right here in the morning show on ETV, waking you up all across South Africa this morning. Now you're with me, Leroy, and today we're taking a look into the career and incredible work of Dr. Lourens Coetzee. Our eyes now play a pivotal role in our daily lives, and many of us, honestly, sometimes including myself, take for granted how important looking after our eyes really is, especially seeing that we use them every single day. I mean, right now, I'm using them as I'm reading my autocare. And Dr. Lourens Coetzee is the clinical director of the Sandton Eye Clinic and a specialist in cornea and refractive surgery. It sounds higher grade, but that's exactly why I have him here today to unpack what this means. And today he's here to give us a deeper look into his career and what we can do to help look after our eyes on a daily basis. Dr. Lourens Coetzee, welcome to the morning show.
Oh, thank you, Levi. Thank you for having me.
I mean, such an interesting topic. And I mean, I think when I was putting this together, we do really take for granted our eyes every single day because we just feel like they're there, they do what they need to do, and we carry on with our lives. But it's so important to look after them.
Yes, yeah, definitely. So I like to divide vision into 3 age groups, and then it's important to look after your eyes, and there's specific things that you can do in each age group, so that you can protect your vision for the following age group. Like for instance, when you're younger than 18, it's important to limit screen time. Like we like the green space outside. And let children play. Also very important is your optometry visits.
Right.
So like before a child goes to school, like have your eyes tested when you're in high school again. And then as soon as you find that you need spectacles, keep an eye on that script. If you find that it needs to, it jumps quite a bit, then see your optometrist should refer you to an ophthalmologist just to make sure everything is fine. There's multiple things that we can do to protect your refraction and your eyes, so that when you are 18, between 18 and 21, so that you can actually have laser vision correction.
Right.
Again, from 18 up to 45. Don't smoke,
Oh, wow.
Very important. So that you can protect your eyes for when you are older, in your 60s, preventing you from or trying to limit the chances of getting AMD or age-related macular degeneration.
You spoke about it earlier now in your answer to me about limiting screen time.
Yes.
And to be honest with you, it almost seems like impossible these days because everybody is on their phones constantly, whether it's social media or creating content. But it must be super important to stay off it. And then what is enough? Because how do you balance that?
Yeah, so I think in our day and age, it is a challenge. What I would rather say is try and balance it with playing outside.
Right.
Like time outside. Like small kids, they need to play. They can't just sit in their cupboard or in their rooms on their iPad the whole time. Let them play. Every day, 2 hours outside. They need the sun. They need a little bit of green space, and that's actually going to try limit your nearsightedness. That you can actually develop. If you spend all your time just looking close.
And I mean, it's so difficult because even now before this interview, I was trying to put my phone down on the table. You're cognizant of your phone or your iPad constantly. So to detach is then so important. And just as long as you have those small breaks, right?
Yes, yeah. So they say if you do a lot of PC work every 20 minutes, take a 20-second break, just looking 20 feet in the distance, and that's actually just going to help the ciliary body and I'll relax, so that you can just reduce that eye strain or eye fatigue that you can get.
I mean, when I came and started here at the morning show, I was a bit nervous because sometimes I do wear contacts, but luckily enough, our screens here where we read autocue from, the font is big enough for me to read, but I mean, there's still a little bit of a blur. So if that camera had to move a bit further, it's interesting how and I'm 37, but your eyes do deteriorate as you get older naturally, right?
Yeah, so it's not necessarily your distance script that changes, it's more your reading ability.
Right.
So from the age of 45, that's actually when you like start getting the long arm syndrome.
Yes, we see like mom and dad sit like this.
Or if you wear glasses, they will actually start giving you like multifocal spectacles. And even in our profession where we do like laser vision correction for people not to wear glasses, I will never say that you're going to be spectacle independent after the age of 45.
Of course.
It is rather less spectacle dependence, because it's always going to be that small percentage of your visual demands where you're going to feel that I need a little bit of correction, and that's where like you're still going to use that little bit of glasses now after the age of 45.
What you do, Dr. Coetzee, is super specialized, and I mean, you know, when doing research for this interview and looking around, obviously you see the photos and some of them are like, whoa, okay, there's things happening in my eye, we're lifting this. Just give me kind of like in a nutshell, what exactly is laser corrective surgery and how does it work?
Okay, so basically there's 3 types of laser vision correction procedures. You get trans-PRK, where we just ablate the surface and we change the shape of the cornea. And by changing that curvature, we're actually changing the eye's ability to focus the image onto the retina. So, for instance, if you are nearsighted, that image falls in front of the retina. And by actually flattening that surface, you move the focus point to fall on the macula itself at the back. And so trans-PRK is one of the procedures. Another one is LASIK. That's probably our most commonest procedure. And that's where you create the flap, you ablate the surface and you put the flap back.
You literally...
Yeah,
essentially you cut into the eye.
So we use a laser where it creates like thousands of small little bubbles, and it's like perforated surface. And then the last procedure is what we call calyx. So that is where we cut a small lenticle into the corneal surface, also with a laser, and we make a small keyhole, and then you take that little lenticle out. And the whole aim, again, is to just change that curvature of your front lens, and which we call the cornea.
Wow. And these procedures are sometimes super quick, right?
Yeah, so for instance, trans-PRK is usually about 40 seconds an eye.
Wow.
Yeah, so it's very quick. LASIK is about 2 minutes. The calyx is around about 5 to 10 minutes because you need to dissect the lenticle. Yeah, but it's a quick procedure. Recovery also varies. Like with the trans-PRK, although it's the shortest procedure, your recovery is a week. Versus LASIK, where the recovery is about a day. Yeah.
It's just so crazy to fathom that, like, within a few minutes, you can have almost perfect vision.
Yeah, so we try and aim to give you as good a vision as your glasses, or like often even better.
So before we wrap this interview up, I have to ask you, like, besides giving me tips and tricks of how people watching right now can look after their eyes and increase their eye health, is it true that one needs to eat their carrots for good eye health?
Yeah, so I think it's good to eat your vegetables.
Right.
Yeah, so but like I think that the whole idea comes from the carotene, beta carotene, and that is important for your photoreceptors. What I would rather say is more important is leafy greens. Really, smoking is our biggest culprit for eye diseases later on in life, and then reduce your fat intake. Yeah.
Oh, so tough, so tough. Listen, always so great to talk to a doctor who's here to help and, you know, help us see better. And in this case, I mean, it fits my profession so perfectly because I use my eyes every single day. So I had to invite you here to give me kind of just, you know, tips and tricks and just a bit more intake into what you do and how important is it. You are at the Sandton Eye Clinic, so if people are watching, want to get in touch with you, they can contact you via the website, everything?
Excellent, yeah.
Perfect, perfect. Well, listen, thank you so much for coming and waking up early, firstly. But I feel like doctors do wake up early, right?
Yeah, we do wake up early. It's like we are up and going like by 6 o'clock already, eh?
Sure. Exactly that. Well, all the best for today, and I'm sure you have many procedures today, and hopefully I'll be seeing you very, very soon, because you know what? It's so important for us to just look after our eye health and make sure that we can see better every single day. Thank you so much to Dr. Lourens Coetzee from the Sandton Eye Clinic right here on the morning show, giving us an intake into pretty much what he does as a career, but what are those steps and procedures we can do to, one, correct our eyes, but also look after our eyes on a daily basis. There's a lot more coming up on the morning show. We'll see you very, very soon.